So now we're going to be looking together at what happened with COVID, because obviously that's the thing that's on most of our minds. So I think now we're just going to watch the videos. There's 4 different testimonies from COVID, very different experiences. People have lived through it in their own way. And then after that, Funmi is going to be asking some questions to the people who did the testimonies. And if anybody else would like to ask any additional questions, please type them in the chat, and we can read them out as well. Okay, thank you very much.
Hiya, I'm Ria and I'm from the UK, and I'm going to give you my testimonial video. So during the pandemic, did I avoid going to hospital? I definitely did. I was absolutely scared. I found new ways at home to try and cope with my crisis at home. I had about 3 or 4. I just tried lavender baths, meditation, yoga, all different types of ways to completely avoid me going in. Where did I get information during lockdown, and where could I find it? So I actually literally fed off the internet and fed off our government websites. I didn't actually have full solid information because everybody was just saying different things. So I couldn't trust it to a certain extent, but I just had to go by what I heard. Did I continue to receive care during lockdown? I definitely did. So after trying to be at home and complete all my crises, didn't work. I had to go into hospital, but I must say I received the best care that I've had in years during the pandemic and having a sickle cell crisis. Everything was fast action, drugs were dispensed fast enough. The hospital wards were great because obviously we had to be infection controlled. The doctors were extra careful with myself because of my sickle cell. So I must say the pandemic done something great, because it was the best care that I received during a pandemic, and obviously during my whole sickle cell crisis. Do I feel like our situation was different during COVID? Definitely yes. So it kind of hit reality, basically got to me to realize that if I catch this, I could die. So I really took on my health, and I thought, wow, this is really serious. So yeah, I definitely thought my health was different. Every little sniggle, I thought I was going to catch COVID. I was very on edge, and my anxiety literally rose 100% because I didn't want to go anywhere or touch anything in case I caught COVID. What were my support during COVID? My parents, my family, my friends. We literally all came together. We done Zoom calls, checked each other's symptoms and stuff like that. So yeah, they were a great support to us. Did you find other tools and contact modes during COVID? I definitely did. Instagram and social media has been a big help. Myself and other sickle pages on Instagram from around the world and across the UK, we joined up. We done Instagram lives to check in to see how everyone was dealing with it. And it was a complete success. So overall, the pandemic has been bittersweet. Obviously, we've been completely scared, but I can say that throughout the whole pandemic, the positive for me was that my care was a lot more better, as a lot of the doctors just took that extra time and that extra carefulness to look after myself during this time of my illness. So yeah, thank you.
Hello everybody, my name is Desi. I'm a sickle cell patient and thalassaemic patient from Portugal. I'm a member of a ABPH GP association here in Portugal, so hi from Portugal to all of you. So during the lockdown, I had several crises, and thank God I had this amazing doctor that teach me how to take my meds and how to take care of myself during those periods. I won't lie to you, I was popping fentanyls like Skittles, but thank God I could manage it because I was afraid to go into the hospital. I was afraid because I didn't know how they won't how they were prepared to take me in during my crisis with all this COVID nebula around it. So that was my main fear. That's why I didn't went to the hospital. So after the lockdown, I started rebuilding myself. I started working again. I'm a physical therapist and a sports medicine specialist. So we work in the clinic with a basketball team. Um, and during that period, I'm telling like Augustus, yeah, during that period, one of our athletes got tested positive for COVID. So I was a little bit afraid at that time because I didn't use all the habits, all the protections that I needed to use. So and I explain why. Because I didn't want to send the wrong message to them. Because I, if you work with an athlete, you gotta send the positive vibes. If I was all with the protections and everything, uh, I'm totally sure that I didn't get the trust that I wanted to have. So that's why I didn't use it. And when he tested positive, I was very afraid during that period. So um, from the period of making the test to getting the test, the result of the test, I was like banging my head against the doors and the walls and everything because I was too stressful because I knew that I cut some slack during the treatment. Um, and I was one of the persons that was most with him. So my stress levels were above the sky. But thank God everything came all right. I tested negative, so everything was cool. Um, and my stress levels went down too, and therefore my crisis also got a little bit better. Um, Thank God I have this support network that works pretty well for me. I got my wife, that's my rock, and my family is too supportive. My daughter too is too understanding for her age. She's only 7, but she already knows when daddy wants to play and have the energy to play, and when daddy's sick and don't play. So for her age, she's pretty mature. That was my testimony. My name is Desi Temporário. Goodbye.
Hello, my name is Jeanna and I am French. I live in south of the country, south of France, Marseille. And I have sickle cell disease. I am 35 years old. I'd like to tell you about my experience in the hospitals in Marseille during the pandemic. I actually did avoid going to the hospital or to the doctors, to my GP, because I didn't really know what was going on. At the beginning, we did not have that many information, and the doctors told us to be very careful. Unfortunately, I had to go because I have a follow-up. I have transfusions every 4 weeks. So for this, I went to the hospital. It was just 1-day appointment. I also had to experience going back to the hospital because I had a crisis, a painful crisis. And for this, I was very lucky in Marseille. We were very lucky because we had a great specialist who made sure to call every single of his patients to tell them what was going on and to ask if they needed anything. So with the lockdown, we were lucky not to have lots of people who got the COVID in Marseille. I think it was only one person who did very well, actually. But as far as I am concerned, I experienced pain in my chest. I didn't know if it was only a crisis or if it could be something else. So I managed to call my specialist and tell him that I was not feeling that well. He asked me to go to the ward in Marseille, and I didn't go through the ER because it was just crazy. So I can say that I had a pretty good experience during a pretty good experience. Of course, it was painful, but let's say that the care that I received in the hospital were very good when you take into account everything that was going on in the hospital. So even though it was complicated and it was quite scary, I have to say they did great. Now it's getting more and more complicated. We don't really know what's going on, and we have lots of questions. So to have answers, we just call our specialist or go through the organization as West Club, because they make sure we gather all the information and give them to the patients and families. Thank you very much.
My name is Andreas and I come from Cyprus. I'm glad I have the opportunity to participate in the conference this year. Again, although under different circumstances, but I'm sure that the outcomes would be very useful as well. During the pandemic, I did not avoid going to the hospital, but we had to follow a specific schedule that the clinical doctors had given to us. I also had a painful crisis, chest crisis, so have been hospitalized. The most difficult part that case was the delay I encountered before my hospitalization in the emergency, waiting for 6 hours until my COVID test result came out. Actually, there are no protocols for sickle cell disease crisis in the emergency in Cyprus, so this made things even more difficult. I got information about the virus during the guarantee via TV news, the internet, and official government daily reports. I have trusted information, recording measurable data like the numbers of the patient infected and statistics. But the instructions for using the mask or gloves, or both of them, was very confusing, especially at the beginning. In Cyprus, the sickle cell disease patients were not ranked in the most critical groups, so a lot of them had to continue going to their work normally. Our Sickle Cell Disease Patient Association demanded from the ministry to reconsider our requirement in order to include our patients in the highest risk category, but unfortunately we did not have an official response so far in this problem. During the lockout, being a teacher, I stayed home and offered online lessons for my students. My health situation was not different, but I was psychologically influenced by cause of the fear of infection and of course for my family safety. I had the opportunity to contact other members of Sickle Cell Disease Patients Association via teleconferencing and other social media. I also participated in a webinar of Thalassaemia International Foundation in Cyprus for COVID. I have not received any information about what actually happened to sickle cell disease patients that have been infected from COVID. I hope the physicians and other participants, researchers, have some data on this. Thank you again for the opportunity to participate at the conference.
Okay, thank you very much. Before we have the chance to have the slightly longer debate, we have one more live presentation. So this is Nazala, who is going to speak to us from Nigeria. And this is about participating in the third sector, in the voluntary sector during the COVID pandemic.
Hello, everyone. Thank you for the opportunity to join in on this session. Last time I was at ASCAT due to visa problems. I came in and the patient session was already over. but I'm so excited I get to join in. So I'll be talking about the role of voluntary and third sector during the pandemic. I volunteer for Sophia Sickle Cell Foundation. It's a non-profit organization, and the main goal is to create awareness about sickle cell anemia in Nigeria. It's located in the northern part of Nigeria, in Kaduna State to be precise. So, as we all know, the third sector and charity, they're basically charities and social enterprise, and also voluntary groups that seeks to bring about policy change. So in Nigeria, basically, we do that either by lobbying politicians and influencing government officials on the need to impact groups or whatever it is you want to volunteer about. Now, also, the third sectors also help to deliver essential services and help to improve well-being and contribute to economic growth. So most times, the government can't always go to some places, and we see that lapses and try to cover it up. And that is why we volunteer. Now, during the pandemic, as we all know, it was like the whole world came to a stop. Like someone had a stop button somewhere and it says, you know what, everybody stop. So we encountered some problems in the course of running the activities of the NGO. Basically, the major challenge is the sector has not been able to raise income. So our thin financial reserves are now very, very tight because we couldn't get funding to carry out our normal activities like we used to. And even though the funding actually is really, really small, but we try from our own pockets to just see what we can do. But during the pandemic, everything came to a stop. And it was actually quite painful to see that you couldn't do the usual thing you do for your patients. You couldn't do the usual thing you do for people you always want to see improve their quality of life. But we couldn't just stop, so we tried what we could do. And instead of reaching out to 500 patients, we could only make drugs available for 100. And that is way, way below normal. So normally in the foundation, what we do is with a little, as little as 1,000 naira, I think that should be $3 or so due to the exchange rate. No, $2, maybe 2.5, 2.8. You could actually make available supply for a month for patients living with sickle cell anemia. But now we couldn't even reach the quota of 500, even though our patients database has now increased to 1,000. And we don't really have funding to do that. And also, our awareness programs were halted because there were lockdowns imposed in like all over the country. So we couldn't do the normal awareness we do. Our awareness is split into two. We have the Know Your Genotype campaigns, which we go into some areas and we take blood samples and then we test so they will know their genotypes. Now, we couldn't do that because, again, there was no funding and the whole country was experiencing a lockdown. Then also we raise awareness by visiting schools and areas and teaching them about the importance of knowing their genotype and also the importance of donating blood so that people living with sickle cell anemia could also, but we couldn't do that. So all that was halted because, again, there was no funding and the whole country was in a lockdown. Now, however, the team is still working and we're hoping to adapt to the new normal because, as we all know, the whole world has not been able to go back to what we see as normal. And I'm sure that's why we're all having ASCAT on our screens rather than being in London at the moment. So those were the challenges we faced in doing that. And well, for the positives, we're coming up with new strategies to help us pass our messages better. So we're trying to see how we can send our messages into those areas we cannot visit right now, and that's why we have tried to transcribe our messages in different languages. We've done it before, but now we're putting in more work to transcribe messages in different languages so they can get to places we cannot visit at the moment. And we're coming up with ways to ensure we maintain a level of funding that our campaign needs, even though that's not going to be easy, but we're trying to see new strategies we could put in place so we could get funding and move on with our usual activities. And also we're increasing our efforts to continue resourcing and maintaining the existing campaigns we have currently. So we're working twice as hard to see how we could balance and give the usual support we give to our patients. But one other thing is, even with the current situation of the country, aside the 100 patients we were able to deliver drugs to during the lockdown, when hospitals started to open up a bit, we went to the clinics and we were able to provide them with basic COVID-19 guidelines, like instructions, and then we were able to stock up clinics with sanitizers, soaps, so we could encourage them to maintain proper hygiene during the COVID-19 pandemic. So generally, it hasn't been easy, and as usual, the number one challenge is and has always been funding. But we're hoping something good will come out of it, even though like in Nigeria, there was a coalition of I think philanthropists and businessmen that came together to donate like funding so that people could have food. But I think everybody is concentrating more on COVID, and other sectors are being looked down upon. Like you have to have symptoms of COVID before you are allowed in the hospital and all that. But we're trying to see how we can actually change that, because we need to pay attention to our warriors. So basically, that's what Sophia Sickle Cell Foundation has done, and we're still hoping to see how we can do more and we could do better. So thank you.
Wonderful. Thank you, Nazala.
Thank you for sharing your video testimony. That was actually very helpful for us to listen to. Just a quick summary from what you said. It seemed like your hospital experience was quite positive, albeit in amongst, the anxiety of the pandemic and, not knowing what's going to happen and how things are going to run. It sounded like the care that you received was actually really, really good. So I guess going forward, hopefully when the pandemic is no longer an issue, what can we learn to make hospital admissions better for people with sickle cell and thalassaemia?
I think that what everyone needs to learn is that we are actually just as important as anybody else is. And I feel like because sickle cell is such a small thing, especially in the UK, there's such every single area has small bits of sickle cell. So I feel like it's not really looked upon as much as it needs to be. People that were diabetic, that had asthma, they were first call priority for anything. Where I feel like now they have learned that actually sicklers are just as important as anybody else is. And from my experience, just going a little bit more in depth, is that normally, I'm from London, and normally my hospital stays are terrible. I avoid everything to go into hospital. I'm normally mixed in like a A&E kind of stay, where people with like coughs and colds, people that has everything is basically on the same ward as the sicklers. We're all mixed up. And this time during COVID, it's going to sound crazy, but I actually enjoyed hospital. We had side bays. We was on I was on a ward which actually treated people with blood cancer. So it was like, and I was a bit like, so why wasn't this happening? Why wasn't it happening from before? I know that blood cancer and sickle cell are two different things, but you have a hematology department there. Why wasn't me here before? So had a TV in my room for the first time, being adult care. And I know it sounds so silly, but it's the small things that make your stay a lot more better. I had cleaners coming into my room like every hour on the dot. I had tea out of a mug and not a polystyrene cup. I know it might sound so silly to everyone, but these are the small things that makes you want to stay in hospital and actually get better than hurry up your stay and kind of go home with some of the pain. So overall, I just feel like this whole pandemic has, I think, definitely taught the UK and definitely taught a lot of people that sickle cell is on the same level as everybody else. So just another thing quickly to point out is that my workplace doesn't know about sickle cell. I've had to teach them about sickle cell. I'm one of the only Black managers within my whole region in the UK. So my illness is not a big thing for them. And when we had the shielding, sickle cell was actually on the letter in writing saying that people with sickle cell need to shield. That small little thing changed my life at work. They were like to me, what? And I was like, it says it here. They're like, okay, you know what? Come off straight away. We don't even want you in. Go home. We're going to pay you full. There's no ifs, no buts. And this is coming from someone that's had a crisis, been in hospital for a month, and I'm battling to get paid just because they don't understand the in-depth of my illness. So I just feel like now that we've kind of been put on the map, even though it's a little bit, it just needs to be kind of pushed a lot more further now that we're on there. And I know COVID is not the greatest, but on my behalf, and I think in the UK, it's brought out that sickle cell actually is something that needs to be looked upon.
Thank you, Ria. Just another question. So in your video, you talked about not wanting to go to the hospital, but now, given your experience, would you still delay or would you come in more sooner?
Okay, so now things, because now COVID's kind of like, not lightening up, but it was just kind of dying down a little bit, and now we've gone back to our peak. Hospital stays are very, very 50-50. So now the issue is that when I go into hospital, yes, we get a great ward, but because there's such a need for COVID, not everybody is trained on the ward that can deal with sickle cell. So the advantage is, okay, yeah, you're comfortable. The disadvantage is that you have to wait a little bit more now. If you want like a PCA, not everyone's trained on that. If you want certain drugs, not everyone's trained on that. So the disadvantage is that, yes, it's great, but it's better care, but these people do not know how to look after sickle patients. If you're lucky, you'll get a ward where they can, e.g. the blood cancer situation. But if you go to another ward where you're not, you don't. You're kind of like having to tell them, okay, well, this is what I need. Give me this. So basically, you're kind of being the doctor and the patient at the same time. So I guess nothing's perfect and it is hit and miss, but they have actually come to realize that, all right, we've got to start changing things. So when I go to hospital tomorrow, if I needed to, but I wouldn't be so resilient to. So I think it's 50-50 for me. Definitely 50-50.
Great. Thank you very much, Ria.
There's a question from the
yes
about interactions with GPs and the confusion with shielding and not shielding. And I think I just wanted to say that Ria, this is in the UK, it's had this positive effect on you. But I think we heard from Andreas that they weren't told to shield where he lives. So just wondering whether that's had an impact on other people. So very few people were able to shield really, truly. So shielding really means not to see anybody, and you should use the kitchen and the bathroom, at a different time, or even if possible, a different kitchen and bathroom, which isn't really available to a lot of people. But a lot of people, they didn't really shield, but they stayed home. They didn't go to work. Some people didn't go out at all during the 12 weeks. Some people still went out once a day. There was a mixture of things. So there's some questions for me in the chat from Jeanna about what's next for patients with sickle cell disease? It's getting hectic. I'm not sure the care we were given during the lockdown will still be as good as it was. And I was thinking that as well, Ria, when you were saying we finally know how important it is to treat sickle cell, but my heart kind of sinks and thinking, can we maintain that?
So just from my point of view, so my hospital are now basically in a little bit of a disarray about what to do, but there is finally talks about having a ward for sickle cell patients in my area of London. So I live like in northwest London, which is under Brent, and never in my I'm 27, so never in my adult years have I ever heard that. We've always just been thrown here and there wherever there's a bed to be in. So for the first time, they're actually thinking about, okay, we need to kind of put a ward together. So I think that's the highlight, obviously, on my area. I don't know about anybody else, but yeah. So for us, it's nearly there, but until we get it, I can't praise it yet. But the talks are in the motion.
Yeah, it's very interesting. Hi, I'm Jeanna. I'm sorry, I'm just like coming because my sister lives in London and it's been hectic for her. She's on her own, and it's like I don't want to talk only about London or France. It's just that we received kind of like, let's say, good cares during the pandemic, the lockdown, I mean. But right now, they can't delay more the surgeries and the other patients who are going in the hospitals. And for example, I was in hospital, I don't know, 2 weeks or 3 weeks ago, and it was just crazy because you have patients with diseases like ours, and you have other patients. So they are having more and more people, and we're still not a priority for them. So this is a problem. During the lockdown, it was okay, but now it's not okay at all. So what can we do to change that? This is a problem right now, for me, anyway.
In the UK, I feel like even though the guidance is for us to shield, like Noemi was saying, it's very difficult to do. So I guess you kind of have to judge it on your own individual circumstances, and kind of find the best thing that works for you going forward. So if it's going out for one walk a day, then you go out for that one walk a day. If that's going to mean that from a mental health perspective, it's going to keep you well. So I think it's very difficult to kind of, give one rule for all. In the UK, we're at a situation now where the numbers are starting to go back up. We have different local lockdowns, different areas of the UK are in different tiers. So the situation is not ideal. So I guess from a patient perspective, it's liaising with your medical teams and reaching a plan that works for you. Does anyone else have anything to add?
You were saying how the hospitals are hectic. I feel, speaking on the UK again, I feel like the hectic period, like throughout every single day of the year, they're always hectic. So I feel like I know that it's probably not to our standard, but I feel like we kind of got to explain to our doctors that actually, yes, we've had that little bit of a better care. What more can you do for us? And I think that's where it kind of lies on us. So I spoke to my team. I said, you know what? This is what I found great. Just having a side room, for example, having my own space, I found that a lot more better for my mental health and for my well-being. Can this be an ongoing thing? And so now they've put on my notes that on everyone's notes within my area that every sickle patient needs to come in and have a side room, because again, it's going to help us with not catching any other infections. So I feel like it kind of depends on us to just highlight where they are doing the things that are okay. That's better than before, because before COVID, hospitals were hectic.
Ask a question. I just wanted to find out, like other countries, how it's been comparing to Australia. I know for sure for us, it wasn't as bad. Most of the cases were in the elderlies. I don't think there was any patient who was a sickle cell patient who was affected by sickle cell disease. But just in terms of testing, I don't know how other countries were faced. For us as an organization, Australian Sickle Cell Advocates, we actually had to write, just to be on the safe side, in the initial days, they're only testing under certain criteria. If you have been out of the country and if you have any symptoms, if you have been out of the country mostly, and if you just have presented like you're in the country and you presented to ED, because of the testing kits are not enough. So sickle cell patients were not a priority. So we had to write letters to them, different ministers of health, different states, to actually say, like fight for sickle cell patients, why they should also be put in that category of patients where even if they don't meet that criteria, even if they haven't been out of the country, that they could be, if they show symptoms, they could be treated. So I don't know how it was for other countries, but for Australia, the first few months, they are choosing which person had to be tested, depending on whether you were out or not. So I just don't know what other countries have been facing in terms of just being a priority for testing purposes.
There's a question from Elena here. I have a question about the initiatives worked for COVID-19 because millions of adolescents are living with sickle cell. I think, well, maybe, I don't know if Subarna, being a pediatric hematologist, you can say something about how you're informing your patients.
So yeah, I can give you an overview. So I think what we have been saying to our patients or young patients and parents of teenagers, etc., is that based on what you've just heard from Noemi, and this is UK information, we've had that people, and that's actually well reflected in reports we've had from elsewhere in the world, that children are doing very well, and sickle cell patients are no different. So although we've had a few children, we've had no children under 20 in the UK who needed, extra sort of breathing support or needed to go into intensive care to go on a heart-lung machine or so on and so forth. So children, anybody under 20, even though they contracted the COVID-19, have actually done relatively well. So initially, as you've heard earlier in this session, the government advised that everyone with sickle cell disease should try and keep themselves away and inside their homes and not mix with others and so on. That was for 12 weeks. But then remember that all of us then had to, the schools were shut and everything. But when schools reopened, it was decided that most of the sickle cell patients could go back to school, because even if they did contract COVID at school, they would not, their lives would not be at a high risk because of how we know COVID affects young people. So in fact, we've had children back at school, and we've had a few cases of children with sickle cell disease contract COVID and come into hospital. And we found that actually, even with COVID, most of them we've managed with supportive care, mainly being quite vigilant, giving them antibiotics right up front if they've got chest infection, giving them blood transfusion or exchange blood transfusions, etc. So that has been fine. But of course, bearing in mind that would be applicable to an infrastructure, health infrastructure we have in the UK, but might not be applicable to other countries.
Say that I have a teenage son, and he's been shielding since March. He has sickle cell, but what's happened is he's got a lot of complications, and even though COVID isn't bad allegedly for children with sickle cell, we decided that it's too risky to send him to school. And we've been in a big, long and hard struggle battle with the school. However, his hematology consultant has now written a letter advising that he does remain shielded until they can. So basically, he was supposed to have exchange transfusions, and they just failed epically, and because they just could not get the cannula in, and there's lots of complications. I won't go into it, but so basically, we are still shielding him, and at last now the school has agreed that his absence is not going to be unauthorized, but it isn't easy. And I think for parents, if you feel strongly as we did or do, it's really important to fight for your child if they've got certain complications, because it's not just about a child with sickle cell. We're talking about children who perhaps have got other issues health-wise.
And I think it's very difficult when the people who make the decisions kind of make a blanket decision about a group of people, isn't it? And at the end of the day, there will always be exceptions, and it's not fair on the exceptions to have to be lumped in with everyone else. So thank you for making that point. That's a really good point. And I think we can also hear just quite how much hard work and emotional energy it takes to fight that battle.
So just picking up on the chat, I see that we have another question from Olabeke to Nazala. So Nazala, thank you for your presentation earlier on. You said that you usually have around $2 to $3 US a month for medication. What does that treatment actually include? And are you only located in the specific area of Kaduna, or are you in other areas and locations?
We try to make sure every patient has access to like basic needs, and by that I mean the normal folic acid, anti-malaria, because we're in Nigeria and it's we're prone to malaria a lot because we still have that issue. So just folic acid, anti-malaria, and some painkillers. Now for the painkillers, we just do paracetamol and light painkillers because we don't want to have patients abusing drugs. So we just do like paracetamol, but we advise if the pain persists, they should go and see a doctor. And for people who have to travel, say like maybe 10 kilometers before they get to hospitals, and sometimes they don't even have access at all, that is where we give out those kind of packages, so that at least before they can afford to get to the hospital, there's something they can fall back to, like to kind of like assist them, because most times we've gathered that patients always get down with malaria like all the time. So we give them anti-malarial drugs, we give them folic acid and painkillers. That is what that $2 can actually afford us monthly.
Thank you, Nazala. Just another question for you. Do you also provide basic needs? So, for example, food, shelter, help with school when needed, or is it just medications?
Yeah, when needed, we actually go out of our way because we're all about improving quality of life. So lots of times we have to crowdfund to see how we can buy food, we can buy beddings like clothing because of the weather conditions, because it's getting cold now in Nigeria. Sooner or later, like the rains just started to cease. So we actually go out of our way to see if we can afford it, and we know that yes, a patient actually needs it, we do it for them.
And are you only based in Kaduna, or are you in other areas of the country?
We started, like, our office is in Kaduna, but we have branches. We have volunteers scattered around. So anywhere we get 2, 3, 4 volunteers, we try to see if we can establish a base around there, and then send whatever it is we can send, and that is how we just basically like work.
And have you tried to partner with other sickle cell organizations in the area of Kaduna to manage the difficulties that you guys are experiencing?
Well, the problem now is that's where the problem comes in, because a lot of times people don't really, I would say the truth, people don't really see the importance of partnerships, which is very, very bad. Like, you know how advocacy is. Not a lot of people advocate because causes are actually dear to their hearts. Some people advocate because of what is in for them when they advocate. So when you reach out to some organizations that have an edge over you and say, "Oh, please, we would like to partner," sometimes they turn down your request because they want to own that field. Like, there's that problem because they want to own that field. And a lot of times I try to tell people that if we say we're fighting for one goal, then it shouldn't matter who is doing it, as long as we're all doing it right. Like, we should put our heads together, we should partner, but it's always a problem. That's a big problem we're facing, a very big problem. The only people that have agreed to partner with us a few times are the hematology unit of Ahmadu Bello University Zaria. Like, they've helped us a lot when it comes to blood drives, because we advocate for blood drive too. Like, we try to teach people the importance of donating blood. So the only group of people that have actually partnered with us in doing that is the hematology unit of ABU Zaria. And we have a very strong relationship with them, because they help us sometimes even with our Know Your Genotype campaigns. So we take samples and we take to them, and we get like some percentage off to run those tests. So those are the only, but then even with the fact that there are other sickle cell foundations, partnering has been a problem.
So it's a question from Sola specifically about adult sickle cell patients who, because I said that they did get well after contracting COVID, but she's asking, does having a pre-diagnosed lung condition make patients fare worse in any way because COVID is a respiratory disease? And the answer is, Sola, we don't actually know. So at the moment, the data that we put together is just very basic data. So we took people's, what's your diagnosis? Are you SS? Are you SC? And then we just did, was your swab positive? Did you come into hospital? Did you need anything like intensive care or extra oxygen or anything like that? And then what happened? But we're going to collect all that anonymized data with lots more details about people's underlying health and all of that. And that will be collected later, because we have to wait for ethics and ethical permissions to come through before we can take that forward. But hopefully we'll be able to answer those questions. So thank you, everybody. I think we draw this session, well, not the session, but this section of the session to a close, because we have to move on to the next section. Thank you for everybody who did the videos. I could tell they were from the heart. Thank you to Funmi for moderating. Thank you to everybody who asked questions or answered questions or gave their experience.